So the next we'll be talking about is the therapeutic use, or we can call them the clinical use. Which one is used in the hospital and why are they using it and what are they used for? And what is the most important reason they are using them for specifically? Even though in another video I'll be talking about them personally, but you just have to know their generalized function. So next one, we'll be talking about the central acting and skeletal muscle relaxant. Like I said, they act in the brain and spinal cord in order to reduce or prevent the binding of acetylcholine, thereby or either increasing GABA in the brain. So if you increase GABA in the brain, you cause relaxation. And we also have the peripheral, whereby they prevent the binding of acetylcholine on the receptor. You see, especially in the neuromuscular junction. So you see that you can understand it like this. Now, what is the central acting agent used for? Now, first one, they are used to relieve muscle spasm in back pain and fibromyalgia. So the back pain can be caused due to impingement of the nerve. So when the nerve is impinged or there's overexcitation of the nerve, what happens? It brings pain. We also usually call it neuropathic pain. And you also have fibromyalgia. It's used to relieve muscle spasm, especially in back pain and fibromyalgia, because anytime there's pain or when there's an irritation to the area, what will the muscles do? The muscle will contract it to come together, and the contraction of that muscle causes pain. It is also used, we are talking about the central acting agent. They are using treating spasticity. Do you know what spasticity is? Is when we have contraction, preventing in range of motion, especially in your limb. So when there's spasticity, when there's excessive contraction, what happens? Especially in cerebral palsy. So patient with cerebral palsy, the spasticity is too much. It is too much due to the damage of the motor areas in the brain. So when there's damage of the motor areas in the brain and the descending neurons that causes you to move, what happens? It will be spastic. If you watch some of our playlists, you'll see how we talked about some clinical cases. So you go there and watch your cerebral palsy. And if we have not done it, we'll try to do it so that you watch it. So the next one is multiple sclerosis. In multiple sclerosis, what happens? The myelin sheath is out. So if the myelin sheath is out, the nerves are not really transporting information. So if they are not transporting information, what happens? It can also cause spasticity. So you can see them in cerebral palsy, you can see them in multiple sclerosis, and you can see them in spinal cord injury. So in spinal cord injury, it can be a transection, it can be a hemisection, it can be incomplete transection, it can be any other causes. So any other causes that causes spasticity, you can use the central acting agent for it. It can be baclofen, it can be tizanidine, it can be diazepam, it can be cyclopentazole, it can be anything. Also, diazepam can be used in tetanus, seizures. Also, when we go to the anti-anxiety medication, you can also see. So when there's anxiety and there's seizures, the muscles tend to be stiff. You get it now? So that's why we have your tonic-clonic seizures. You get it now? So, but diazepam can be used, but it's just that diazepam is not good because patients can become tolerant to it. So one, it can be used for spasms, which is caused by back pain and fibromyalgia. It can be used to treat spasticity, and it can be used for tetanus, seizures, anti-neurolytics. So very, very important. But the peripheral acting on now, listen, we have talked about the central acting on, but the peripheral acting on, actually dantrolene. So dantrolene specifically can be used to treat malignant hyperthermia. Malignant hyperthermia. So in malignant hyperthermia, it's also used as a lifesaver. It's very, very important. So mark it dantrolene, malignant hyperthermia. Also, it is used to manage chronic spasticity. Chronic spasticity is very, very important. So when a patient have had spasticity for over a long period of time, especially patients with cerebral palsy that has not been treated for a long time, so you can also give dantrolene to decrease calcium, which will allow you to move the hands. You get it now? Also, the neuromuscular blockers, first of all, they are used as adjuncts in our anesthesia. So they use them as adjuncts in anesthesia, especially in general anesthesia, where they give the patient in order to make him to be paralyzed, so the patient will not be able to move. So they give the patient the neuromuscular blockers in order to cause paralysis. So why are they doing it? To allow the muscles to relax. Hope you are getting it. One, they are used in adjuncts in anesthesia, especially general anesthesia, for muscle relaxation. You get it now? Two, they facilitate endotracheal intubation. Endotracheal intubation. So if a patient is not breathing well through the nose or through the mouth, and you want air directly through the trachea, you have to put an endotracheal tube directly by cracking the patient. So when you crack directly on the trachea, what happens? You open the trachea and you put the tube. So you want to give air directly when there's blockage in the nose or in the mouth. So the blockage can be due to excess food particles, or the tongue is rolling back covering the throat. So you can give directly you can open the trachea directly to allow air to go. So that's what we call endotracheal what intubation. And what do you use? You use succinylcholine. So succinylcholine is used directly. Why? Because it has a short duration of action and it has a rapid onset. Because if a patient is not breathing well, you want something that will work fast. You don't want something that will take time. So they use it during what endotracheal what intubation, succinylcholine. And now also in orthopedic manipulation, what happens? You use it as a what electroconvulsion therapy. So you use neuromuscular blockers as electro what convulsion therapy. And the last one, they are using what mechanical what ventilation. Very, very important. So now what are the adverse effects? Because we are talking about the therapeutic use of the center acting agent and peripheral acting agent. So what are the side effects you see? Because when you are relaxing too much, it is not good. It can cause more harm than good. So that's why it should be controlled, especially during general anesthesia. You have to watch the paralysis because you have to now bring the patient back and allow movement also. So the center acting agent, what is their side effects? You can see sedation because what you are doing, you are causing relaxation by reducing some neurotransmitters in the brain. So if you are increasing GABA and you are decreasing your epi and you are decreasing most of the exciting neurotransmitters in the brain, what happens is it's very dangerous. You are causing sedation. So if you are causing sedation you can also cause dizziness. So sedation, when you sedate a patient, the patient becomes dizzy. I get him now. When it becomes dizzy, mistakenly during the course of the surgery, if the patient wakes up, what happens? There will be confusion. There will be what? Confusion. Also, baclofen causes what? Muscle weakness. After, so if the patient recovers, it takes time for the patient to recover. So it can cause muscle weakness and what? Withdrawal seizures. When the patient is coming out of the baclofen that you induce in the patient, what happens? It can have what we call a withdrawal seizure. So when the patient has been on bed for a long time and you are using baclofen, what happens? The patient can have a withdrawal seizure and also muscle weakness. He will not be able, he will be paralyzed, and from there seizure can come. Tizanidine, I told you, is used to treat malignant hyperthermia and also used in chronic what spasticity. But its side effect here is that it causes hypertension. So when you are causing malignant hyperthermia, what are you doing? You are decreasing what blood pressure. It can cause what hypertension and it can also damage the liver, causing what hepatotoxicity. So don't forget, tizanidine causes hypertension and what hepatotoxicity. Baclofen can cause what withdrawal seizures and also muscle weakness. And generalized, all of them can cause, especially diazepam can cause what sedation, dizziness, and also confusion. Don't forget. So that's why you should know most of the drugs before you give to the patient. So now the neuromuscular blockers on the second case now, especially the non-depolarizing, because I always start from the non-depolarizing neuromuscular blocker. So what do they do? So when you are giving the patient non-depolarizing neuromuscular blocker, what can you see there? Especially there will be histamine release. So when you release histamine, what happens? So histamine is what? A vasodilatory endotoxins. Again, histamine is a vasodilatory endotoxins. So what, when the body releases, especially for mast cells, so mast cells release histamine. So when mast cell release histamine, what happens? It vasodilate the blood vessel, and if it vasodilate the blood vessel, there will be a drop in blood pressure due to the increase in diameter. So again, mast cells release histamine. Histamine causes hypertension, and when it causes hypertension, also another important thing, again, tubocarins there under the non-depolarizing causes your bronchospasm. So when you give tubocarin, which is not in use, it can cause bronchospasm, and generalized, they can release histamine, which can cause hypertension. So you take note of all these things, because so when you are relaxing the muscles, you should also take note of what hypertension. Also, there will be tachycardia, especially when you are using pancuronium. There can be tachycardia and hypertension when you are using pancuronium. Don't forget, tachycardia and hypertension when you are using pancuronium. Bronchospasm when you are using pancuronium. Are you getting me now? And the last one, there will be residual weakness, which is the patient come out of the drugs, there can be a small weakness there. Don't forget. But now another side effect that is a lot when you are using succinylcholine. Succinylcholine has a lot of side effects, because when you use succinylcholine, what happens? You are causing a lot of depolarization. So the depolarization will cause what? Flaccid what? Paralysis. So before it causes flaccid paralysis, there will be lots of fasciculation. Why? Because what happens? I am binding to the receptor and allowing the inflow of sodium a lot of times. So from there, something that's supposed to be contraction will now become what? Reflex, what? Relaxation. So what should you work out? It also cause what? Malignant hyperthermia as a side effect. Unlike the first one, we said that dantrolene is used in treatment of what? Malignant what? Hyperthermia. But now succinylcholine gives what? Malignant hyperthermia as a side effect, especially when you use it with hylotane. So hylotane is always a local anesthesia. So when you use hylotane as during When you use hydrogen together with what succinylcholine, it can cause what malignant hyperthermia. Why? Because they are volatile what anesthetic. So you should always take note. So it can cause fasciculation, post-operative myalgia, post-operative myalgia, malignant hyperthermia, hyperkalemia. So hyperkalemia is usually dangerous in burns and neuromuscular diseases. So hyperkalemia, there'll be an increase in plasma or potassium. So don't forget fasciculation, post-operative myalgia. What again? You have what malignant hyperthermia, you have hyperkalemia. So what will happen? There will be bradycardia. Why? Because you are what you are relaxing the heart. So when you relax the heart, there will be bradycardia, especially when it binds to the receptor in the what SA node. So when it binds to the receptor in the SA node, you call bradycardia. Also in the eyes, it can increase intraocular pressure. So if you increase intraocular pressure, what happens? It can be dangerous in the eyes because it can cause glaucoma. So you don't want to do that. Also, it can increase what intra or gastric pressure, which is the pressure when food is coming into the stomach. It can increase intragastric pressure. It can cause bradycardia. It can cause what intraocular what pressure, and also it can cause prolonged what apnea. It can cause what prolonged apnea, especially in what pseudo what cholesterol deficiency. Because you should know that pseudo cholesterol do what inhibit and break down what succinylcholine, so which decreases what duration of action. So when there's absence of pseudo cholesterol, what happens? It will increase and cause what prolonged what apnea, which means the patient will not be able to breathe well due to what reflex constriction of the what bronchus. So always remember, all these are very very easy. So go to it, listen to it, and look at what I'm saying. It is very very important. So drug interaction, what should you not give this drug together with? It is very very important. Don't give this drug together with something. Why? Because if you give it, it can be bad. Potentially you should not give muscle relaxant with what aminoglucoside. So aminoglucoside is an antibiotic, so don't give it together. Don't give it together with tetracycline. Don't give it together. Don't give it together with what inhalation, which is the local anesthetic. Now if you give them together with local anesthetic, it can give what a potential risk to the patient. And also don't give with magnesium sulfate and what antiarrhythmias. Don't give the drug with them because they can either decrease or increase the toxicity of the drug. And also it can be reversed by what? It can be reversed by what? Cholesterol what inhibitors. Do you get it? They can be reversed by what? Cholesterol what inhibitors. So don't give a particularly with what? Aminoglucoside, tetracycline, inhalation what anesthetic, magnesium sulfate, and what antiarrhythmic what drugs. Very, very important. So and they can be reversed by cholesterol what inhibitor, especially the non-depolarizing what neuromuscular blockers. The non-depolarizing what neuromuscular what blockers. So we have talked about the drug interaction already. So the next will be contraindications. It's very important. Where should you not use it? In what patient? So we have treated the side effects or the adverse effect already. So patient with all those cases, you don't have to give them. Especially now, succinylcholine now. We also know that succinylcholine cause an adverse or side effect to be what? Hyperkalemia. So patients presenting with hyperkalemia, where they are what? Where their plasma potassium level is above about 5.3 or is about 5 and above, you don't give a patient with that because they're hyperkalemic already, so you don't give them what? Succinylcholine. Now you don't also give patients with burn. Why? A burn patient has less water in the body and can cause what? Hypotension. So don't give to patient with burn. And also with crush injury, don't give the patient with crush injury, neuromuscular disorder. Also patient with glaucoma because it has an increase in what? Intraocular pressure. Don't give a patient with what? Malignant hyperthermia risks. Don't give to patient. Why? Because it will increase it the more. So also a non-depolarizing agent, because we talked about succinylcholine. So everything that succinylcholine is presenting as side effects, you don't give it to the patient with that because it can increase it the more and the patient might die. So if a non-depolarizing agent, this one is yours straight to the point. Don't give you a patient with what? Kidney or liver injury because they can cause what? Hepato what? Toxicity or renal toxicity. Don't give it to patient with the two of them because it can destroy the kidney. So also dantrolene, don't give it to patient with what? Don't give it to patient with what? Hepatic what? Impairment, because you know the side effect is causes what? Hepato what? Toxicity, and also it can causes what? Weakness and what? Fatigue. Don't give it to patient like that. And don't give it to patient with arrhythmic issue because non-depolarizing agent too can cause what? Tachycardia, hypertension too. And also their blood pressure sometimes can be low high, so you have to monitor all that before you give to the patient. So I hope it all made sense now. You understand everything I've explained in the word skeletal muscle relaxant. So one thing you have to know that skeletal muscle relaxant are crucial drugs in medicine. very important. So they are very, very important. Actually, they are divided, like I said, they are divided or classified into what central acting spasmolytics, which means they inhibit spasm. So they are spasmolytics, or and where you have peripheral acting with neuromuscular blockers, or you have the direct acting agent. So we discussed that the central acting agent are used to what reduce what chronic what spasticity and acute what MSK what condition. What is MSK? Musculoskeletal condition. So they are used to treat what chronic spasticity or what acute what MSK what conditions. Why peripheral? No, now chronic spasticity comes from the brain. So maybe when there are neurons in the brain that are damaged, or the part of the brain, especially the motor center, is damaged, it can cause what spasticity in the lower body. So it is used to reduce it from up. And also, but for the peripheral acting agent, they are very important in what anesthesia. Good. So they are very important in anesthesia, and also critical care for induce what muscle paralysis. So you want to just weaken the muscle in order to, for the purpose of surgery, or you want to cause very important thing due to maybe the patient is having tremors, or the hand is moving excessively, and you want to relax. Anytime you want to relax, especially doing general surgery, you use what peripheral acting agent, because it blocks it in the neuromuscular what junction. Although highly useful, but this agent should be carefully monitored, because all the side effects we give is very, very important, because it can impair the patient and cause death. So they should be monitored, especially patients with what malignant hyperthermia, hypokalemia, hepatotoxicity, and prolonged apnea. Prolonged apnea, there will be vasoconstriction of the airway, and do you know what, the patient will not breathe, lack oxygen, and it could affect the patient. Now, the drug of choice you are using is due to now the what clinical scenario you want, or the desired duration of action. Maybe you don't want it to be short or long. Like we say, succinylcholine has a short duration of action, so we use it for endotracheal intubation. So also, you should also have what good safety condition. So I've explained all these things, and I hope it makes sense to you. So if you are just joining my video, make sure to like and subscribe. So, and share it to all medical students. You get it now? Share it to all medical students. It can be useful for somebody. And when you use it, also make sure that you read it over and over, over and over. Hear me and everything I've explained about all these drugs. So I've given you. So also look at all the description I gave, and look at how it works. You get it now? It's very, very important, because this classification, we are under drugs that act on the peripheral nervous system. We have done drugs that act on the autonomic nervous system, so we are in the peripheral. So the next we're going to is under what local what anesthetic, or local what anesthesia. So drugs that are local anesthetic, that work locally, not the one that work generally doing so, the one that we need to numb a particular area. That's what we'll do next. So I'll see you in my next video. Bye bye.